Thanks, Scott. Thanks, everybody, for coming out. We've also got in the audience Mayor Dan Pope. The mayor actually had a fantastic press conference yesterday, and he had leadership from the city, he had leadership from the health department, going over what the city would do and what the area would do in case of a coronavirus outbreak here. What we're going to give you today is a bit of a snapshot. And when I say a snapshot, I mean that kind of literally, because this is such a fluid situation with this viral infection that the decisions we talk about today that we've made, the plan that we have developed today is based on the best data we have as of today. That is very likely to change by the end of next week or the week thereafter or a month from now. So this is one of those things where we just want to make sure that all of you are aware of the fact that we've been in communication with leadership from all of our universities within the Texas Tech system. We've been in contact with our elected officials, both local as well as down in Austin. I've been in contact with chancellors from the other systems. This is something where we're all kind of walking through this thing together. So I want to talk for just a sec as a parent, as a physician, and as an administrator to you, because this is something that is impacting real lives of folks. As a parent, it's really difficult when you're looking to see, okay, my children are entrusted to a university system where they're not where I can take care of them literally, physically with me. We've sent them out to a university where they've got surrogate parents out there helping to take care of them. So first and foremost, I want to be sure as a parent that my children are safe. And you're going to hear messages about that as we walk through this. As a physician, this is one of those things that I know Dr. Cook did a great job yesterday about walking through the virus, but I want to just reiterate some of that to you to let you know how difficult this thing is to get our arms around as physicians. So you had this thing start out in Wuhan, China, at this seafood mart and live animal mart, where the first round of transmissions were felt to be from animals to people. And not long thereafter, as this infection started spreading, you were getting people that were getting infected that had not been at that market. And so folks started realizing you've moved from this animal to human transmission to now where you have person-to-person transmission. As that kind of worked its way along for a while, given the fact that the world is so small because of travel the way we have it, then you started realizing these cases were popping up all over the globe. And to date, we have more than 100 places internationally where this virus has been noted. So at that point in time, folks started realizing you've got what's called community spread. And community spread is a very specific thing. What it means is people are coming down with the infection when they're not exactly sure where they got it. They weren't, to their knowledge, in front of somebody that was coughing and sneezing or whatever, but they still got the infection. So we do know about this particular virus. It comes from a family of viruses that are extremely common. But this particular strain of it is more infectious than something like influenza. So it's pretty easy to catch it. And it's not only easy to catch it from person to person, but it may be very easy to catch from sputum and saliva and other things as people get sick. So from a medical standpoint, what you're finding is you'll get a little cluster of these things start happening, then over the course of a week or two, you get a big expansion in that area. So one of the most important things that we're trying to impress upon everybody, our students, our staff, our faculty, is the importance of what are called non-pharmaceutical interventions. So everybody here has heard about the things about wash your hands, wash your hands, wash your hands. Extremely important. Everybody's heard about don't touch your face. Everybody's heard about the things where you try to keep yourself distanced by about 6 feet from other folks, especially somebody that seems like they may have allergies or sneezing or coughing or something like that. There are also very important things. You're going to hear about some of this when we talk about what we're going to be doing at the universities. that you call the environmental interventions. And that's making sure that the surfaces stay clean. That every time somebody's been in an area, that we're doing a really good job of coming behind it and keeping things extra clean. So when it comes to things like serving food, doing it on paper plates, using plastic cutlery instead of steel things that have to be hand washed and the like. So there's a lot of these things that we're going to be putting in place just to be with an abundance of caution, because we're parents too. We want to make sure that our kids are being taken care of. The one other thing that you're going to hear about is you're going to hear about our students that we have internationally. And this is how fluid the situation is. We currently have over 100 students that are studying abroad. And literally just a week ago, the majority of them were in countries that were low-risk countries. Well, just over the course of the past week, many of these countries are now deemed to be high-risk countries by the CDC. So we're bringing all of our students home that are out there internationally. And so getting back to my original point, this is something that is really impacting lives. We've got students that are abroad that we're really looking forward to these great experiences. We're impacting them. We're impacting their families. We're impacting students that we're expecting to be able to take family trips on spring break. We're impacting our student athletes, students that we're expecting to be able to be in the most exciting part of their athletic career while they were in a university, and all of that's being impacted. This is real for a lot of people, not even to mention the economic impact that it has on things like this. Is really impacting people's lives. So you're going to hear from our two presidents, and then we're going to talk a little bit about it, and I'll talk a little bit about what's going on at some of our other campuses, because this is one of those things that has impacted us as a system, not just as individual universities. So next we're going to hear from Dr. Lori Rice-Spearman, and she's going to give you an update on the Health Sciences Center.
Good afternoon. The health and safety of our students, our faculty, our staff, and the communities we serve is our top priority. And because of that, our leadership team has made the decision to suspend on-campus classes March 16th through March the 27th. This suspension will allow us time to prepare to deliver curriculum beginning March 30th via online instruction. We feel like this is the best way to protect our students and also to serve our community. University operations are going to continue as they always have. Our faculty and our staff will be on campus, and they'll be ensuring that our clinics are running. We are deeply committed to caring for our patients in our community, and so those clinics will be open. What we're asking is that if you have mild or moderate symptoms, that you not come to the clinic, the urgent clinics, or the emergency department. Instead, we want you to call us and get guidance from us on where you need to go to seek care. We are going to have some resources on our website, and I want to give you that website right now, www.texastech.ttuhsc.edu/coronavirus. We will be updating that every day, providing resources to our communities and our clinics. Also, before I pass this on, I want to make sure that you understand, as a Health Sciences Center, we're not just here in Lubbock. So those affected also include our campuses in Midland, Odessa, Abilene, and Amarillo, and Dallas. Thank you very much. At this time, I'd like to introduce President Lawrence Scobin.
I'd like to begin by reiterating a sentiment that the Chancellor and Dr. Rice-Spearman have made, and that is, through this process, we've been guided, above all, by the safety of our students, our faculty, and our staff, understanding that this is a very difficult time for everyone involved. So this morning we issued a memo announcing that we are canceling classes the week after spring break, effectively extending spring break for a 2-week period. After that, we're going to go to online delivery of all instruction until further notice. Now, we understand this will have an impact on the quality of the educational experience. Many courses are delivered through an online format, but the majority is still face-to-face. So even a week ago, we began to put together resources, materials online, to help faculty and students make that transition. And those links have been identified for the students and the faculty. Workshops are planned this week and into next week, helping faculty make that transition from face-to-face to online delivery. Dr. Mitchell referred to the situation for students studying abroad. We have 105. A special email went out this morning letting every student know that we will be making efforts to bring them back, and we will cover the cost of that travel to come back to the United States. We've also canceled those special student excursions during the spring break. And again, we have compensated the students for any financial cost in those cancellations. We are keeping the campus open, and in particular, the dorms and the residence halls. I've had some questions, why are you doing that? It's because many of these students have no other place to go. And so we will be providing meals and a place for them to stay. Even some time ago, we began to enhance sanitary measures to make sure in high traffic areas we've taken extra precautions to try to avoid the spread of the virus. And in particular, places like the library and the rec center. I think what else I should mention? Athletics. Dr. Mitchell alluded to the fluid nature of this situation. Athletics is a good example of that. Yesterday, we had an emergency call with the Big 12 Board of Directors. As you might be aware, last night we actually had fans for the first games, but we made a decision yesterday, the board did, that we would go to a fanless format. When we met today, we were going to discuss whether we were going to continue with the tournament. Just during the course of that conference call, other conferences began to announce the cancellation of their tournaments, and so we made that same decision. As I walked in here, Robert Giovanetti informed me that now the NCAA has canceled the entire NCAA tournament, both for men and women. Earlier this afternoon, there was a special meeting of the Big 12 athletic directors, and during that meeting, they agreed to cancel all spring sports through March 29th. That also has implications for recruiting, out-of-season practice, that's been canceled until March 29th, which impacts spring football. In-season practices can still continue. So, in particular, there will be no baseball this weekend. As for other events on campus, we're strongly discouraging any large gatherings and trying to limit those to less than 50. And so this is an evolving issue. We've prepared an FAQ site. We have a very active site. If you go to Texas Tech's main site, very prominently displayed there is the site that deals with all issues related to the virus. And there's an FAQ. We've received hundreds of inquiries. We're actually distributing some of those inquiries to the most appropriate department, whether they're of an academic nature, study abroad. But we will we will respond to every student who reaches out to us. And I think that covers the essential points.
One of the questions that's come up already over and over and over is going to be about graduation. Oh. They do have various options in place based upon what's going to be going on 30 days from now, 45 days from now, and the like. So there are various scenarios.
If I could elaborate on that, those in charge of graduation met with us today. There are 4 different scenarios that we can go to as to how we're going to handle graduation depending on where we are. We will make an announcement on March 30th of what our plans are as to how we're going to deal with graduation. It's very likely it will not be the experience we've had in the past.
Right. And then I just want to just for a moment talk a little bit about Angelo State University and the Health Sciences Center at El Paso. And this just illustrates how when something's going on within our system, it impacts everybody. So Dr. Skubinek from Texas Tech University. They had a statement going out this morning, but as a consequence of that, they were getting a ton of calls at Angelo State University and a ton of calls at the Health Sciences Center in El Paso saying, hey, we see that Texas Tech is closing and extending the spring break time. Are we doing the same thing here? So this is literally one of those situations where we really do have to respond as much as possible as a system, keeping in mind that all four of the universities, each one of the universities has their own unique set of needs. Each one of the universities has its own unique set of circumstances, and so the prescription, if you will, from one university to the next might be a little bit different. That gets confusing in Lubbock because you have the Health Sciences Center as well as Texas Tech University on the same piece of property. So we're going to try to make sure that we keep that as clear as we can. But please also understand, and this was verbalized yesterday by Mayor Pope, everything that we're doing is out of an abundance of precaution. There have been no suspected cases of coronavirus anywhere on any of our campuses. So this is something where we just want to make sure, given the situation that we have, not just out here in West Texas, not just in the state, not just in the country, but worldwide, given that situation, if we're going to err one way or the other, we want to err on the side of taking care of our students, our staff, and our faculty. It's interesting because, you know, the Chinese word for crisis is Weiji, and it's made of two Chinese characters. One Chinese character means danger, the other Chinese character means opportunity. And so in a situation like this, there is a danger that's out there, but there's also an opportunity for us to do the things we need to do to make sure that we can make the very best out of a problematic but fluid situation. So with that then, we're going to open it up to questions that y'all have, and we also have Robert Giovanetti here from Athletics for questions if you have specific questions that Dr. Skubinek can't answer. But anyway, any questions you have, you guys chime in. Y'all want to come on up?
Christy Martinez Garcia with Latino Lubbock Magazine. On the dates for convocation, how soon will we be able to share that, or will you share that with us?
As I mentioned earlier, we intend to make a final decision on March 30th, but information has already been posted that is alerting students and their families to the possibility of changes. And if this,
Hey, Lawrence, come on around by their mics over here.
if this situation accelerates, we may have to make a decision earlier than March 30th.
Sir.
What is it about this situation that makes it different than outbreaks in the past?
Can we talk about that? So, I mean, if you talk about viral infections in general, viral infections typically have a fairly well recognized incubation period, a fairly well recognized pattern of symptoms that people will develop, and then a fairly well recognized pattern of illness that occurs from it. The issue with this particular virus is that the incubation period seems to be off. It can be anywhere from a day up until a couple of weeks. Because it is a little bit more infectious than some other viruses, you can have folks, generally speaking, if you're looking at things like influenza or the common cold even, you pretty much know when you're around somebody that's sick. And so you can do things to keep yourself healthy. But in this situation, there are a number of people through community spread that come in, and when you ask them about being exposed to people who are obviously sick, they don't describe that. And so one of the things that makes this problematic is the fact that people with very mild symptoms, and sometimes perhaps even with no symptoms at all, can still be carrying an active infection. So you want to just make sure that you're ahead of it as much as you can. And so a lot of the things that we've done, and you've heard the people in the news talk about this, it's still a low risk overall, but it's not a no risk by any stretch. And the way it's moving through populations, we want to err on the side of taking care of everybody. And this is more than just a little inconvenience. This is hugely problematic for faculty and staff, students, and their families to do this. But we want to make sure that we're just erring on that side because it is different than most viruses we bump into.
Casey Davis with News Channel 11. Y'all have touched on if you have mild, moderate symptoms, stay at home. Could you kind of clarify what constitutes a mild to moderate symptom?
Yes, mild to moderate symptoms would be fever, low-grade fever, sniffles, those upper respiratory symptoms that you tend to have, a cough. We're concerned when you become shortness of breath, high fever, blue around the lips, and you're having difficulty talking. Those are what we would consider the serious symptoms. And again, just to reiterate something the Chancellor said, we're really concerned about three populations: the immune-compromised populations, the populations that have chronic diseases that we have to control with medication, and then our third population that's recently come to light is our pregnant population. So those are really the groups that we're trying to protect.
Donald Rubio with Bailey's Corridor. So you mentioned that students will be allowed to stay in the residence halls, but most students will be leaving for spring break and coming back. So what efforts are being made to ease students' mind that someone won't bring back the coronavirus, and what efforts are being taken to heighten precautions?
One reason we decided to go to an online format was out of concern that when students would leave, they would come back possibly with the virus. And so students could possibly continue their coursework with very little contact on campus. But one thing we will be doing, we'll be communicating more extensively about the social aspects of how we deal with this, advising them, making some of the same recommendations you've already heard from the Chancellor and Dr. Rice-Spearman about how they go, like so many other aspects of this virus, the implications have a personal effect, they have a financial effect, and a social effect, and that's very much the case with athletics.
Will you be talking to the athletic department personnel at any point, or is this press conference serving?
Kirby and I have communicated almost continuously through these last few days. Last night, this morning, when he was boarding the plane to come back, and we were very much in agreement on the course of action that we're taking, and he'll be meeting with all the other coaches and all as they continue to adjust to this.
And we have a separate press conference.
Oh, no. In visiting with Robert Giovanetti, I think the preference is going to be to let the league take the lead in making statements, and Kirby will be issuing a statement. And then possibly that could change, but that's the plan right now.
Christy Martinez Garcia with Latino Lubbock Magazine. We focused on the students, but now let's talk about the staff and faculty, because I know that a lot of folks usually take spring break off and leave.
Yes.
What's your plan of action for staff and faculty?
Yeah, that's a very good point. Right now, we expect staff to continue to report to work as usual, but if the situation worsens, we're ready to take more drastic measures. Maybe identifying what are considered the most pertinent personnel that have to be there, the essential personnel. We'll adopt a very flexible policy as it relates to leave, sick leave, FMLA, and things of that sort. So that's, I didn't mean to minimize in focusing on the students that we're not equally concerned about the staff and faculty.
And one of the things that we're recommending to everybody, and this is, and I think probably most of you would agree with this, if there's any year for a staycation, this is it. Just because you don't know, you're going to be traveling through airports, you don't know who's going to be sitting in plane seats around you, you don't know who you're going to bump into in restaurants. So if there's any time for people to just say, hey, look, this is a time for maybe, not the best time for us to take a big family trip someplace, this would be the year to do that.
And you mentioned opportunity as part of that
Right.
Chinese word. Would you say that this, taking everything online could be an opportunity for the future for Texas Tech to do a little bit more of this and maybe save some dollars or?
Well, it's in, you know, I'll leave the online discussions to these two with it, but the fact of the matter is, we're gonna have a lot of our faculty that work toward preparing more online courses than they normally would have. So it certainly is an opportunity for them to learn more about that technology than they otherwise would have.
There's been a real evolution in how we deliver our instruction. Right now, about 20% of the student credit hours we teach is through online. So there's a very significant number. I wouldn't say that this is going to translate into a real transformational way as to how we deliver our curriculum. And because some courses, like activity courses, voice, dance, they really require that face-to-face interaction. But also, it's been interesting to me reading the comments I'm getting from students. Many of them are very concerned that they won't have the same contact with the professor, with classmates. That's an essential part of what a residential campus is, where you rub brains together. And we're never going to get away from that. But this could probably help educate certain people into what online delivery does provide as a possibility.
Meredith Oldest, Officer in Fire, question about the online. Are online classes cheaper?
There's a misconception that delivery through online is cheaper, and it's really not. When you have to limit the number of students in an online class, more so than a large lecture class with 300 to 400, there's the technology behind it. And so I think that is a misperception in the public that it's cheaper. It's not. And one thing we did at Texas Tech about 3 to 4 years ago, we established the Texas Tech e-learning department, where we really began to invest in sort of the professional training of how you deliver online courses. And so there's a lot of capital invested in that manner of delivery.
So there would be no possibility for compensation or anything?
For, excuse me?
Yes.
For compensation? Students have raised that issue. That is not on the table. Some faculty have asked, will I receive extra compensation to make this transition? That's also not on the table.
So currently, over 50% of the students who are members of our Health Sciences Center family actually receive their instruction via online. And so really, we're seeing this as an opportunity to get creative and think out of the box. Our nursing faculty and staff have already circled up and began thinking creatively about simulation and how they can deliver simulation so that we don't have a loss in the student experiences. And they've come up with some fantastic ideas. So yes, we do think it is an opportunity at the HSC.
Can I ask one more question? A lot of students do like capstone classes, or they do the research studies, which is very vital as they're preparing for graduate school or that are in graduate school. What about that opportunity? How are you going to help those students? Because it's important for them.
Yes.
For the completion and for the research.
Yes. That's also a very good point. We've had a few inquiries about that. In those instances, we're directing those students either to the college or the department. And the manner in which we're going to address all of those circumstances is still is ongoing.
And the same for the HSC. We have several PhD students who are wrapping up their research, their master's level theses, getting ready to defend dissertations, and so we're working with them one-on-one to do everything we can to not delay their graduation.
Austin Washington, Daily Corridor. Earlier, there was an email sent about samples that have been received. Is there resources being devoted to like researching the virus, and then how does that play with the testing?
Samples have been sent to our BSL-3 laboratory out at the Reese Technology Center. And there actually is a video on our website where all virus issues are addressed, where Steve Presley, who is the chair of the Department of Environmental Toxicology, provides a very nice Q&A session addressing how those samples are handled emphasizing all the safety measures in place and of that sort. You might refer to that.
We have time for one more question. If anybody has anything else? Okay. Thank you all for coming out.
Thanks, guys. Lauren.